This podcast is a production of IPRO. The primary purpose of the podcast is to educate. Listeners acknowledge that they are not being provided any advice or services by the speakers. The speakers are expressing their views and opinions only, and not that of any company or agency for whom they work. Any reference to a specific product or entity does not constitute endorsement of that product or entity. The podcast is for private, non-commercial use only. Please visit our website at IPRO.org for our full disclaimer.
Welcome to the Kidney Cast, the podcast that focuses on end-stage renal disease.
The Kidney Cast is a production of IPRO, a trusted partner of federal and state agency working to measure and improve the quality of healthcare for all.
We are your co-hosts, Brooke Andrews
and Shezeena Andiappen. This is our third episode, and we're so excited to be on this journey with you. We welcome all listeners, including dialysis patients, dialysis professionals, and those who just want to learn more about the end-stage renal disease network.
September is National Emergency Preparedness Month. In this episode, we're going to talk about ways for dialysis patients and dialysis professionals to prepare for emergencies.
Emergencies can happen at any time. Preparing for emergencies and knowing what to do can help keep you, your family, and the community safe.
We have another special guest on this episode. Our special guest is Julia Gesick, Emergency Management Lead for the ESRD Network Program. She's going to talk to us about emergencies, how they can impact your treatment, and how you can be better prepared for the unexpected.
Julia, thank you for joining us today.
Thank you for having me.
So I know dealing with emergencies can be very scary and challenging for anyone, but especially for our dialysis community. Before we get started, can you tell us a little bit about yourself?
Sure. Like Shezeena said, hi, I'm Julia. I'm an emergency manager focused on helping dialysis patients stay safe and prepared before, during, and after disasters. I work closely with clinics and communities across 13 states to make sure patients can maintain access to life-saving care no matter what's happening around them. I'm especially passionate about making preparedness really simple, approachable, and something that actually works in real life, not just on paper.
Thank you so much, Julia. We definitely appreciate you being here today. So we can get started. Can you tell us a little bit about what can be considered as an emergency?
Sure. An emergency can consist of everything from weather-related events like hurricanes, winter storms, wildfires, to small-scale incidents like a local power outage or a water issue. Especially in dialysis, we have to consider so many elements to ensure treatments run smoothly and every piece of the puzzle fits.
That's so true. And emergencies can include so many things and are often so unexpected. I know growing up on a lake, it was really common for us during hurricanes that we had to prepare to evacuate. And so many times I think that's something that people truly don't prepare for. You know, they tell you to be ready to, but when it actually happens, I know during Hurricane Matthew, when my family had to actually evacuate, it was just devastating. So I can't imagine how it feels when you also have a life-sustaining treatment that you have to attend as well. Shezeena, will you tell us about an emergency that you've experienced?
Brooke, thank you so much for sharing your experience dealing with an emergency. I'm sure we all could think of a time we dealt with an emergencies. Emergency can be related to so many things, weather-related and non-weather-related. I remember in July 2019, my family and I went to Florida. So we rented a van. We left Fort Lauderdale to visit my family member in Fort Myers. When we left, it was about 1 p.m. It was hot and sunny. Maybe about 30 minutes into our drive, it started to rain so hard, it got so dark suddenly. We couldn't see. So we decided to pull over. While we were pulling over, lightning struck our van, shutting the engine down. Two of my family members then got out of the van and pushed it over to the side of the road so we can wait for emergency assistance. While we were on the side of the road waiting for help, within minutes, the whole front of the van went up in flames. We were all able to get out safely and wait for help. We were waiting on a intersection of Interstate 75, I believe. In that interstate, they actually nicknamed it Alligator Alley. So it was so scary, but luckily we were safe and we saw no alligators. But the car was, however, total. By the time the police arrived, the sky was clearing up, the rain was stopping. stopping. It was definitely a scary moment, but the important thing was that we were all safe. So things could happen in a minute. We just need to try to stay calm and do our best to prepare for emergencies.
Shezeena, that's an insane story. Thank you for sharing that with us.
We will be right back after this message.
What does better healthcare realized mean? Well, for military veterans and others, it means knowing that their healthcare meets the highest standards of quality. IPRO is seeking physician reviewers to join our case review panel for state and federal contracts. We're looking for board-certified physicians with at least 5 years of active clinical experience who currently work at least 20 hours per month on direct patient care. In return, you can work as little or as much as you'd like reviewing cases for medical necessity, appropriateness, utilization, and other measures. You'll be compensated by case and also rewarded by the knowledge that you've helped ensure that the highest quality of care is provided to our nation's veterans and other vulnerable patients. That's what Better Healthcare Realized is all about. Learn more by visiting ipro.org/clinical-reviewers or calling 888-404-6285. That's 888-404-6285.
Julia, can you tell us why emergency preparedness is so critical for our dialysis patients?
Yeah, of course. It's really critical for dialysis patients to prepare for emergencies because missing even one treatment can be life-threatening. And in a disaster, access to care, power, transportation, or communication can be affected. And a little planning now can help you stay safe and connected when it really matters.
Julia, I totally agree. Can you tell us a little bit about how patients can prepare for emergencies?
There's so many ways. You can start with creating an emergency plan. You can sign up for emergency alerts in your area. You can keep a battery-powered radio to stay updated on news and instructions.
Thanks for those great tips. What can patients do to prepare for power outages? Because we know a lot of times with emergencies, power outages are a part of that.
Definitely. You can have a backup power source for medical devices if needed. You can also notify your utility company about your special needs in case of power outages.
In emergencies, transportation can also be a big problem. Any tips on how we can deal with transportation issues?
Transportation is huge when it comes to emergencies. My best piece of advice would be to have a plan for how you will get to dialysis if public transportation or if your transportation provider is disrupted. You can keep a list of local transportation options on hand.
Thanks for those tips, Julia. And what about tips for creating an emergency plan?
When emergencies hit, being prepared makes all the difference, especially for dialysis patients. You can start by knowing where to go if your regular dialysis center is closed. Keep the contact info for a few alternative dialysis clinics handy and share your plan with loved ones. Put together an emergency kit with water, kidney-friendly, non-perishable foods, medications, medical records, a flashlight, batteries, and radio. You can also make sure you have a written list of your medication, dosages, and recent labs. You can talk to your doctor or your dietitian about an emergency diet and stock up on low-sodium canned goods and bottled water. You can also keep your dialysis center's number nearby and stay informed through the news, alerts, and your care team. Regularly check and update your supplies, make sure your meds aren't expired, and mark your calendar to replace anything that's gone bad. It's also smart to stay connected. Pick an out-of-town contact person who can check in with you and keep a list of important healthcare contacts. A little planning now goes a long way.
Julia, those are a lot of great tips. Simple planning can definitely go a long way during emergencies. In emergencies, you can get stressed, confused, and panic so easily. So preparing can definitely help you stay calm. We talked quite a bit about how patients can prepare for emergencies. Julia, can you tell us a little bit about what can dialysis provider do to help themselves get prepared and help their patient prepare for emergencies?
That's a great question. And one of the biggest things dialysis providers can do is make sure that they know where their patients actually plan to go during an emergency. A lot of patients head to stay with family or friends, which doesn't always get documented. So we end up scrambling to find them when they miss their treatments. And having an updated emergency contact and plan on file helps a lot. It's something that you can review right before an emergency is happening. And beyond just knowing where patients are, it's also important to keep lines of communication open with transportation providers, backup facilities, even other providers in the area. If there's a disruption, everyone being on the same page can make it easier to coordinate care quickly and safely.
Julia, thank you. Can you also talk a little bit about the ESRD Emergency Hub app?
Definitely. The ESRD Emergency Mobile Hub is a free app designed to help dialysis patients stay safe and connected during emergencies. It puts critical resources right at your fingertips, like emergency diet plans, clinic locator tools, preparedness checklists, and real-time alerts. Whether it's a power outage, storm, or other disaster, the app helps you plan ahead, know where to go, and stay informed. It's simple, easy to use, and built specifically with dialysis patients in mind. You can download the app in the Google or Apple app stores, and it's available to anyone. However, the alerts currently only cover our 13 states.
Julia, thanks so much for joining us today. As you can tell, being prepared can make a significant difference in managing emergencies effectively.
I agree. I have the emergency app on my phone, and I love getting the emergency alerts and knowing what's happening in my community. Julia, we thank you for all you do for our community. Links to more information about this work can be found on our website at esrd.ipro.org. If you are new, not familiar with the ESRD function, please refer to the network's resource called Empower Yourself to learn more about our network's program. We also have an emergency management section with a lot of information and about how you can download our app and emergency management preparedness.
That's it for this episode of the Kidney Cast. I'm Brooke Andrews.
And I am Shezeena Andiappen. On behalf of IPRO, thank you for listening. To learn more, visit our website at esrd.ipro.org.
If you enjoyed this podcast, please leave us a comment and subscribe. Please let us know what topics interest you or what you would like for us to cover by emailing ESRD Network Program at ipro.org. We will be back soon. Until then, we'll be working on better healthcare realized.